Our topic today is what our healthcare professionals think versus what we as the pharmaceutical industry think, what we as representatives or product specialists think. And the vocabulary for today's session is pretty simple, but we'll concentrate on how the words are used. And the words are represent, change, risk, resistant, facilitate change, alleviate risks, and unique selling point. So, what do we as medical representatives think? We know that we represent an excellent company. We know that we have an excellent product, and we want our healthcare professional to use our superior product. We want them to see that our product is different and better for specific patients. We want him to change his prescribing habits. And for us, change means growth and opportunity, positive things. Now, what does our healthcare professional think? To the healthcare professional, we represent possible change. And for the healthcare professional, change means risk. And the HCP wants to avoid risk at all costs for himself and for his patients. So change for the HCP doesn't necessarily have positive connotations. For him, it's risky. So the healthcare professional wants to believe that our product is the same as what he has experience using, what he's used to using. So what can we do to facilitate the change in his prescribing habits? Well, we have to alleviate the risks. We have to help him come to the conclusion that the benefits of our product outweigh the possible risks. But this isn't necessarily very easy. Besides educational meetings and webinars, what can we, as product specialists or representatives, do to facilitate the change in his prescribing habits? Well, there are two definite things that I can think of. Perhaps you can think of more. Number one is relationship, and number two is unique selling point. Let's look at relationship. The relationship between the representative and the healthcare professional. When a representative has been calling on a healthcare professional for a few years, a relationship naturally develops. And relationships are the heart of our industry. That's why management should hesitate and think carefully before changing the representative's territory or the healthcare professional lists for their representative, or indeed laying them off, because we don't want to risk the relationship which only continuous calling fosters. When we have built a relationship with our healthcare professional, there is trust, and he is far more inclined to listen to us. And indeed, this alleviates risk. This mitigates risk. The second thing, and something that we can action, is finding a unique selling point. This means some little thing that our product covers and the opposition doesn't cover. So our product will cover one specific patient need that the opposition product doesn't address. For example, if we're lucky enough to be selling Tamiflu, well, Tamiflu has a unique feature. It is one of the few antiviral drugs approved for the use in pediatric patients, which is a crucial option for children during flu seasons. So we have to find the unique selling point for our particular healthcare professional. And perhaps the drug he's used to using comes in tablet form, but we have an oral suspension. So if we can find our healthcare professional to think of perhaps one of his patients who is elderly and swallowing tablets might be a daily struggle for this patient, then we have a unique selling point for our product for a specific patient, because our product comes in a patient-friendly liquid form. So we are finding a solution and we're enhancing the patient's quality of life. Or, for example, diabetes. Now, perhaps we have a tablet form anti-diabetic agent. And our HCP is used to going straight to insulin needles. We all know that some patients really dislike needles. It's a genuine concern. So if we can get our healthcare professional to picture in his mind one of his patients who has this genuine concern about needles, then we found a unique selling point for this particular healthcare professional to cover for one particular patient. And remember, we only need to get our healthcare professional to use our product once. And then if he uses it just once successfully, then the sky's the limit for our products. So finding our unique selling point for a specific patient, for a specific doctor, is not about being different for the sake of it. It's about addressing real life challenges. We are not just talking about efficacy here. We are talking about making a positive impact on the patient's life. Now, one more point, one more thought. Remember that our healthcare professional is the expert. No matter how much training we have or science degree we may have, we may not tell the healthcare professional what he should be doing. Rather, we need to ask him about his thoughts on a specific topic. And then we must be respectful enough to listen with focus, because it's in the listening that we will discover our unique selling point. Now, there's a short exercise to check that we have the meanings of all the vocabulary. Thanks for listening.